Imagine looking down at your hands and seeing bark instead of skin. Imagine thick, woody growths spreading across your body, transforming you into something that looks more like a tree than a human being. For a small number of people around the world, this nightmare is their reality. They suffer from a condition so rare and so bizarre that when doctors first encountered it, they refused to believe what they were seeing. If you're fascinated by the strangest and most disturbing medical mysteries on Earth, make sure to like this video and subscribe to the channel for more shocking true stories. In medicine, there are conditions that challenge everything we think we know about the human body. Diseases that seem to violate basic biology laws, disorders transforming people in ways that appear impossible. Today, we're exploring one of the most disturbing medical conditions ever documented. A disease that literally turns human flesh into something resembling tree bark. It's so rare that fewer than 200 cases have been documented worldwide, and so visually shocking that sufferers are often mistaken for something other than human. This is epidermodysplasia verruciformis, known as tree man disease. The first documented cases appeared in early 20th century medical literature, but the condition has likely existed for centuries. Early physicians struggled to classify, describe, or even believe what they were seeing. The disease begins innocuously. Small, wart-like growths appear on hands and feet. They might look like common warts that millions develop without concern. But these aren't ordinary warts. They have a sinister agenda, and they're just the beginning of a transformation that will reshape the human body in ways defying nature. As the condition progresses, growths multiply and spread. They develop hard, rough texture, bearing uncanny resemblance to tree bark. The resemblance is so striking that people seeing advanced cases often refuse to believe they're looking at human flesh. Tree man disease is caused by rare genetic mutation affecting the body's ability to fight certain human papillomavirus types. Most people easily fight off these common viruses, but individuals with this condition have immune systems specifically vulnerable to particular HPV strains. When these viruses infect someone with this genetic condition, they don't cause ordinary warts. Instead, they trigger cellular changes, causing skin to grow in abnormal, horrifying ways. Infected cells produce massive amounts of keratin, the protein making up hair, nails, and outer skin. But instead of normal skin tissue, this keratin creates thick, bark-like growths covering entire limbs. The genetic mutation is inherited in autosomal recessive pattern. Both parents must carry the defective gene. This explains the condition's incredible rarity. For those developing tree man disease, physical transformation is only part of the nightmare. As bark-like growths spread, patients lose use of hands and feet. The growths aren't just cosmetic, they're functional disabilities making basic tasks like eating, writing, or walking impossible. The psychological impact is equally devastating. Imagine watching your body transform into something looking more like a plant than human. Patients describe feeling like monsters, trapped inside bodies no longer feeling like their own. Social isolation can be overwhelming as people react with fear, disgust, or morbid curiosity. Many become unable to work, maintain relationships, or participate in normal activities. They become prisoners in their own bodies, watching helplessly as growths continue spreading. The world became aware of tree man disease through Didi Koswara, an Indonesian man known globally as the Tree Man of Java. Didi's case was so extreme and visually shocking that when photos first appeared, many refused to believe they were real. Didi first noticed small warts as a teenager, having no idea what would happen. Over decades, these growths transformed into massive, bark-like protrusions covering his hands and feet. The growths looked more like tree branches than human appendages. By the time Dee Dee's case gained international attention, the bark-like growths weighed over 13 pounds and had completely disabled his hands and feet. He could no longer work as a carpenter, could barely feed himself, and had become a local curiosity. People traveled miles to see the Tree Man, often treating him like a freak show attraction rather than a human being suffering from devastating medical condition. When Dee Dee's story reached the international medical community, doctors were fascinated and horrified. A specialist team was assembled to study his case and attempt treatment. The bark-like growths weren't just cosmetic abnormalities. They were living tissue completely transformed by viral infection. The growths had their own blood supply, nerve endings, and complex structure. Removing them required careful surgical planning to avoid permanent damage to underlying healthy tissue. The medical team performed multiple surgeries over several years, removing over 13 pounds of bark-like growths. The procedures were complex and dangerous, as growths had grown deep into healthy tissue beneath. While surgeries were initially successful, victory was temporary. Within months of each procedure, new growths appeared. The underlying genetic condition making Dee Dee vulnerable to HPV infection hadn't been cured, only temporarily managed. This is Tree Man disease's cruel reality. Even with advanced medical intervention, the condition is essentially incurable. Patients can undergo surgery to remove growths, but without addressing underlying genetic vulnerability, growths will inevitably return. It's a never-ending cycle of temporary improvement, followed by relentless progression. The psychological toll is enormous. Patients experience hope when growths are removed, only to watch in horror as bodies begin transforming again. Dee Dee brought international attention to Tree Man disease, but he wasn't alone. Medical researchers have documented cases worldwide, each with unique, horrifying characteristics. In Bangladesh, young Sahana Khatun developed bark-like growths covering her entire body by age 12. Her case was so severe she couldn't attend school or participate in normal childhood activities. In Romania, Ion Toder developed growths so extensive they completely disabled his hands and feet, complicated by life-threatening infections. Each case is unique in presentation, but all share the same devastating impact on quality of life. The disease doesn't discriminate. It can strike anyone with genetic vulnerability. Medical researchers worldwide work to understand Tree Man disease and develop better treatments. The condition's rarity makes research challenging. With fewer than 200 documented cases, it's difficult gathering enough data for meaningful conclusions. Recent genetic research advances provide new insights into underlying mechanisms. Scientists have identified several genetic mutations leading to the condition and are beginning to understand how these affect immune system ability to fight HPV infections. There's growing interest in developing antiviral treatments preventing HPV infections triggering bark-like growths. While experimental, they offer hope for future patients. Beyond medical aspects, there's a profound social dimension often overlooked. Patients with visible differences face discrimination, social isolation, and psychological trauma as devastating as physical symptoms. In many cultures, people with unusual appearances are viewed with suspicion, fear, or superstition. Tree Man disease patients report being called monsters, demons, or cursed. They may be shunned by communities, unable to find work, or treated as curiosities rather than humans deserving compassion. The psychological impact can be devastating. Many develop depression, anxiety, and other mental health conditions from social rejection. Some become reclusive, hiding from the world to avoid stares and comments. Despite challenges, there are reasons for hope. Genetic research advances provide new insights, and experimental treatments are being developed. Gene therapy, antiviral medications, and improved surgical techniques offer potential benefits. There's growing awareness of addressing social and psychological aspects. Support groups, counseling services, and advocacy organizations help patients cope with challenges and educate the public about living with rare medical conditions. Cases like Didi's brought international attention, leading to increased research funding and medical interest in finding better treatments. Tree man disease remains one of the most bizarre and disturbing medical conditions known to science. It challenges our understanding of human biology, raises questions about genetics and viral infections, and forces us to confront that the human body can be transformed in ways seeming to violate nature's laws. For patients suffering from this condition, it's not just medical curiosity. It's daily reality affecting every life aspect. They live knowing their bodies are slowly transforming into something looking more like plants than humans. And medical science currently cannot stop this transformation. The disease raises profound questions about what it means to be human. When someone's appearance is dramatically altered by medical condition, how does society respond? How do we balance natural reactions of fear with moral obligation to treat all people with dignity? Tree man disease reminds us the human body is more fragile and malleable than we realize. Simple genetic mutation, combined with common viral infection, can transform a person in seemingly impossible ways. For those suffering from this condition, every day is a battle against a disease seemingly determined to strip away their humanity. Yet, these patients aren't monsters. They're human beings deserving our compassion, support, and commitment to finding better treatments. If you found this exploration as fascinating and heartbreaking as we did, please like this video and subscribe for more stories about medicine's strangest mysteries. Remember, behind every medical mystery is a human being whose life has been forever changed by forces beyond their control.